Diagnosis and treatment of herpes simplex. Herpes simplex is a contagious disease which is disseminated by direct contact with the blisters or the ulcers infected by the virus by direct touch or the kissing process. So there is another type of spread or transmission of the virus that is called as vertical transmission. When the pregnant mother is infected with herpes simplex, the virus also affect the baby during delivery process when the baby passes through the birth vaginal canal during the labor period and birth process. The baby catch the infection by the herpes simplex virus. This is called as herpes simplex neonatal. So it is a very advisable thing that during pregnancy the necessary investigation of the pregnant mother is done to exclude the chances of the herpes simplex virus. Now, it is a, on observation, it is quite clear from the surface lesions, which in various stages you can observe from simple pimples, crops of the pimples, or the clusters of the blisters that passes from macule, papule, vesicles, pustule, ulceration, and later shedding of the crusts. These are the various stages which passes the disease passes through this process. This process is completed within 1 month when the patient becomes asymptomatic, but the patient is not virus free because this virus cannot be eliminated from the body if once it get entry or the patient once become infected. It may go into the subclinical quantity that doesn't produces the symptoms for the time being, but later on it may reactivate to produce the recurrence of the disease. So laboratory test we have to take the specimen of the blood to study the type of the virus. Then we can also take skin biopsy from the lesions of the blisters for histological microscopic study. Then we had also to detect the antibodies, IgM and IgG, antibodies against the virus in the blood. The most efficient diagnostic procedure is PCR test, by which we can find and detect the antibody produced by the body against the virus. In addition, then there is CT scan, MRI can also be helpful for the diagnosis of the disease. As we know, this virus disease is incurable at present. There is no proper vaccination or effective vaccine manufactured up to now, but the symptoms and the severity of the complaints or the trouble and the complaint and the pain of the blisters can be reduced by the various medicine. The symptomatic treatment is done provided to reduce the temperature, pain by the analgesics and antipyretics, acetaminophen, ibuprofen, proxen medicine, and drugs. They are used along with a small quantity of the steroids. In addition, when the disease is very severe and grievous one, then we can also adopt the treatment of the antiviral drugs. But it is to be remembered that antiviral medicine must be used immediately. I mean the within 3 days, first 3 days. Earlier treatment is effective one. If you delay the treatment, then it is not useful. So there are acyclovir, famciclovir, penciclovir, and dalacyclovir. These are the various drugs used in the form of tablets. Orally, also the local lesions can be relieved by the mixture of zinc oxide, petroleum jelly, xylocan, and the acyclovir drugs. They are used in combination form in the form of ointment or cream for the skin lesions that to produce the soothing effect to the patient. The skin pain can be relieved by the disease. So these are the various steps and the medicine used to reduce the pain and the trouble of the patient.